We're going to talk about something that affects many families today, even more than infections: lifestyle diseases. When I say lifestyle diseases, I'm talking about things like high blood pressure, diabetes, stroke, heart disease, obesity. These are not just medical words. They are the conditions causing many deaths, disabilities, and hospital admissions today. The good news is, many of these diseases can be prevented or delayed, especially when we understand the risk factors and make small changes. Today, we have three main goals: to understand what lifestyle diseases are and why they are so common now, to learn the major risk factors, especially diet, physical activity, tobacco, alcohol, stress, and sleep, to discuss simple, practical steps we can start taking as individuals, families, and communities. Before we start, let's agree on a few simple ground rules. Respect. We respect everyone's experiences. No mocking or shaming. Confidentiality. If someone shares a personal story, we don't take it outside the room with names attached. Participation. You are free to ask questions and contribute. You're also free to just listen if you prefer. Let me ask you a quick question. When you hear high blood pressure, diabetes, or stroke, what comes to your mind? Thank you. Let's now build a clear understanding, step by step. First, what do we mean by lifestyle diseases? Lifestyle diseases are long-term conditions that develop gradually over many years, are strongly linked to our everyday habits, what we eat, how much we move, whether we smoke or drink, how we handle stress, and how we sleep. Include hypertension, type 2 diabetes, heart disease, stroke, and obesity. They are also called non-communicable diseases, chronic diseases. Unlike infections, you usually don't catch them from someone. Instead, they develop slowly from a combination of unhealthy habits, environment, genetics, and family history. A key point: these diseases are not caused by one single thing. They are usually the result of many small things repeated over years. The encouraging part is, if lifestyle can cause many of these problems, then lifestyle can also help prevent or delay them. Why should we care so much about lifestyle diseases? Because they cause many of the leading deaths worldwide. These diseases affect people in their productive years, impacting parents, workers, and leaders. They put a huge financial burden on families through drug costs, hospital fees, and lost income. Lifestyle diseases also reduce the quality of life, as seen with stroke survivors who cannot walk, people on dialysis, or those who can no longer work. Almost every family now knows someone with high blood pressure, diabetes, or who has had a stroke or heart attack. If you know at least one person personally, just raise your hand. This widespread experience highlights why prevention is so important. We are not just talking about statistics, we are talking about real lives. We are talking about parents who want to see their children grow. We are talking about young people who want to live long, active lives. And we are talking about communities that need healthy members to thrive. Preventing lifestyle diseases is not only a hospital issue. It's a home issue where daily choices impact health. It's a church or mosque issue where community support plays a vital role. It's a broader community issue requiring collective action. Ultimately, it is a personal issue, demanding individual responsibility and awareness. Now let's talk about what actually drives these lifestyle diseases. I like to group them into a big 6 risk factors. Unhealthy diet. Too much salt. Too much sugar. Too much unhealthy fat. Too many processed foods and sugary drinks. Too little fruits, vegetables, and whole grains. Physical inactivity. Very little movement. Sitting for long hours. Tobacco use. Cigarettes. Other forms of smoking or chewing tobacco. Harmful use of alcohol. Drinking heavily. Binge drinking. Using alcohol as a way to cope. Stress and poor sleep. Chronic stress that is not managed. Poor sleep quality or short sleep over many months. Family history/genetics and age. Having parents or close relatives with hypertension, diabetes, or heart disease. Getting older increases risk. We cannot change our age or family history, but we can change our habits. Most people have more than one of these risk factors at the same time. Our aim today is not to make anyone feel guilty. Our aim is to recognize which of these risk factors are present in our lives and see what we can start changing. Let's start with hypertension, commonly called high blood pressure. Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps. If that pressure stays too high over time, it damages blood vessels and organs. It is often called the silent killer because many people feel normal. They may have no pain, but the high pressure is quietly damaging the heart, brain, kidneys, and eyes. Common complications of long-term uncontrolled hypertension: stroke, heart attack, heart failure, kidney disease, eye damage. Key points: you cannot know your blood pressure by how you feel. You can only know it by measuring it with a blood pressure machine. Many people only discover they have hypertension after a stroke or heart attack, which is very late. How many of you have checked your blood pressure in the last 6 to 12 months? If your answer is no, one simple prevention step after this session is schedule a blood pressure check. For those already diagnosed with high blood pressure, take medications as prescribed. Do not stop drugs on your own when you feel better. Combine medication with lifestyle changes: less salt, more movement, less stress, no smoking. Next, we'll discuss diabetes, especially focusing on type 2, a condition impacting millions worldwide. Diabetes is characterized by the level of sugar, or glucose, in the blood remaining too high over an extended period. Specifically, in type 2 diabetes, the body either doesn't produce enough insulin or it struggles to use insulin effectively, a condition known as insulin resistance. Over time, consistently high blood sugar levels can cause significant damage to various parts of the body. This damage extends to blood vessels, nerves, and vital organs such as the eyes, kidneys, and heart. While some individuals may not experience obvious symptoms early on, common indicators include frequent urination. Other signs are feeling very thirsty and experiencing persistent hunger. Unexplained weight loss can also be a symptom, along with slow wound healing. Persistent tiredness is another common complaint among those with undiagnosed or poorly managed diabetes. Poorly controlled diabetes can lead to several major complications, including kidney failure. It can also result in blindness, affecting vision significantly. Nerve damage, manifesting as numbness or tingling, is another serious complication. Foot ulcers and, in severe cases, amputations are also potential outcomes. Furthermore, diabetes significantly increases the risk of heart disease and stroke. Several strong risk factors contribute to the development of type 2 diabetes. Being overweight or obese is a primary risk factor. Physical inactivity also plays a significant role. A family history of diabetes increases an individual's susceptibility. An unhealthy diet, rich in high sugar, refined carbohydrates, and sugary drinks, is another major contributor. Given these risks, testing is absolutely key for early detection and management. This includes fasting blood sugar tests or other recommended diagnostic procedures. For individuals identified as being at risk, regular screening is incredibly important. The good news is that prevention, or at least delay, of type 2 diabetes is often possible. Adopting a healthy diet is a cornerstone of prevention. Effective weight control is another crucial step. Engaging in regular physical activity significantly reduces risk. Finally, following medical advice, especially if you are in the prediabetes stage, is vital for long-term health. Let's talk about obesity, cholesterol, and heart disease. Obesity means having too much body fat, especially around the abdomen. It increases the risk of hypertension, diabetes, heart disease, and stroke, some cancers, joint problems. We often look at body mass index, weight relative to height, and waist circumference. Fat around the belly is particularly harmful. High cholesterol and other blood fats also contribute to narrowing and blocking of arteries, leading to a higher risk of heart attack and stroke. Heart disease can show up as chest pain, shortness of breath, palpitations, and in severe cases, heart attack. Key message here: weight gain and high cholesterol often happen slowly over years. Small daily choices, What we eat and how active we are add up over time. Diet is one of the biggest risk factors we can actually control. Let's break it down, starting with salt. Too much salt raises blood pressure and overloads the heart and blood vessels. High salt sources include processed foods like instant noodles, seasoning cubes, and sauces. Packaged snacks, some breads, and canned foods also contribute significantly to our salt intake. For practical tips, always taste your food before adding extra salt. Reduce the use of multiple salty ingredients together and cook more at home instead of always eating fast food. Next, let's talk about sugar. Too much sugar leads to weight gain and raises blood sugar. It also contributes to diabetes and fatty liver disease. High sugar sources include sugary drinks and juices with added sugar. Sweets, biscuits, cakes, pastries, and very sweetened tea and coffee are also major culprits. Practical tips for sugar reduction include drinking water more often instead of soft drinks. Gradually reduce sugar in hot drinks and limit sweets to special occasions, not daily consumption. Now, let's discuss fats. Not all fats are the same. Unhealthy fats, like trans fats and some saturated fats, increase bad cholesterol and heart risk. Healthier fats, found in fish, nuts, seeds, and plant oils in moderation, are better for the heart. Avoid frequently consuming deep-fried fast foods and reusing the same cooking oil many times. Finally, processed foods. Many are high in salt, sugar, and unhealthy fats and are low in fiber. We want to move away from heavy dependence on items like instant noodles, sausages, pastries, and packaged snacks. Instead, we should move toward more home-cooked meals and fresh or minimally processed foods. Think of your last 24 hours. If you had to name the 3 least healthy items you ate or drank, what would they be? Our goal is not perfection. Our goal is better choices more often. Now, let's make it practical. Healthy eating does not mean foreign or expensive food. It means more vegetables and fruits, enough fiber, moderate portions, and less salt, sugar, and fried foods. Some simple ideas. Add vegetables to at least 1 or 2 meals daily. Use fruits as snacks instead of biscuits or sweets. Use smaller plates or bowls to control portions. Reduce how often you eat fast food each week. I want you to imagine a plate. Half the plate filled with vegetables or salad. 1/4 with a healthy carbohydrate, such as rice, yam, or plantain. And 1/4 with protein like beans, fish, egg, or lean meat. This is a simple way to remember balance. Now think, which meal in your day can you start adjusting in this direction? Breakfast? Lunch? Dinner? Write it down or keep it in your mind. I will start by improving with more vegetables and better portions. Now let's talk about movement. Our bodies are designed to move. Physical activity lowers blood pressure. It helps control blood sugar. It helps maintain a healthy weight. Physical activity improves mood and sleep. It reduces the risk of heart disease and stroke. You don't have to be a professional athlete. Examples include brisk walking, dancing, climbing stairs, housework with energy, and simple bodyweight exercises at home. Aim for regular movement most days of the week. Also, less sitting time, standing up and stretching every hour if you sit a lot. If you are able, please stand up for a moment. Let's do a very quick stretch. Roll your shoulders slowly backwards and forwards. Gently stretch your arms above your head, then relax. March in place lightly for a few seconds. You can do this during work or study breaks. Little bits of movement throughout the day add up. Tobacco and harmful alcohol use are major drivers of lifestyle diseases. Tobacco damages blood vessels and lungs, raises blood pressure, and increases the risk of heart attack, stroke, and many cancers. There is no safe level of smoking. If you don't smoke, don't start. If you smoke, seeking help to quit is one of the best gifts you can give yourself and your family. Alcohol. Small amounts may be tolerated in some people, but heavy and regular drinking raises blood pressure, damages the liver, increases weight and blood sugar, and increases accident risk. If someone is drinking, encourage moderation and avoid binge drinking. Never mix alcohol with driving, operating machines, or certain medicines. If you drink or use tobacco, ask yourself, is this habit bringing more benefit or more harm to your health and my family? If the answer is more harm, it may be time to think seriously about cutting down or stopping with support. Stress and poor sleep are like hidden fuel for many lifestyle diseases, silently contributing to their development and progression. When we are under chronic stress, our bodies react in several significant ways, impacting our overall health. Our body releases stress hormones like cortisol, which are designed for short-term fight or flight responses, but become detrimental when constantly elevated. This sustained hormonal activity can cause blood pressure to rise, putting extra strain on our cardiovascular system over time. Similarly, chronic stress can lead to an increase in blood sugar levels, which is a significant concern for metabolic health. Furthermore, as coping mechanisms, we may find ourselves overeating, smoking, or drinking more, exacerbating these health issues. Poor sleep inflicts similar damage over time, disrupting our body's natural rhythms and repair processes. Fortunately, there are simple strategies we can adopt to help manage both stress and improve our sleep quality. Firstly, aim to have a regular sleep schedule as much as possible, going to bed and waking up at consistent times. Secondly, reduce screen time and avoid heavy meals before bed to allow your body and mind to wind down naturally. Thirdly, incorporate relaxation techniques like deep breathing exercises or quiet reflection into your nightly routine. Additionally, talk to someone you trust about your worries instead of carrying everything inside. Sharing can lighten the burden. Finally, use problem solving by writing down your worries and planning small, actionable steps for what you can control. While we cannot remove all stress from life, we can certainly learn to manage it better. By implementing these strategies, we can prevent stress from quietly destroying our health and improve our well-being. Prevention includes knowing your numbers, which is a crucial step in maintaining your overall health and well-being. There are several key numbers you should be aware of to monitor your health effectively. These include your blood pressure, which is vital for cardiovascular health. Monitoring your blood sugar levels is also important, especially for detecting potential diabetes. If possible, knowing your cholesterol levels provides further insight into your heart health. Additionally, keeping track of your weight, body mass index, and waist circumference offers a comprehensive view of your physical condition. So, who especially should get screened for these health indicators? Adults above a certain age, for example, those 30 or 40 and older, should prioritize regular screenings. Anyone with a family history of hypertension, diabetes, or stroke also has a higher risk and should be vigilant. People who are overweight or obese are strongly encouraged to get screened regularly. Furthermore, individuals experiencing symptoms like frequent urination, constant thirst, or frequent headaches should seek medical advice and screening. Why is screening so important for our health? The primary reason is to catch potential health problems early, often before they become severe. Early detection allows for prompt treatment and lifestyle changes, preventing complications from arising. This proactive approach helps you avoid sudden and unexpected health crises, such as a stroke or heart attack. When was the last time you had any health check that included blood pressure or blood sugar? Take a moment to reflect on that question. After this session, I strongly encourage you to decide on a specific date and place where you will check at least your blood pressure. And, if possible, also get your blood sugar checked. We are almost at the end. Now we move from information to action. I want you to think very practically about personal habits. Ask yourself, what is one habit I can start or improve in the next 1 to 2 weeks to reduce my risk of lifestyle diseases? Examples include using water instead of soft drinks on weekdays, or adding vegetables to lunch every day. You could also walk for 20 minutes at least 4 days a week, or reduce salt when cooking. Another simple change is to go to bed 30 minutes earlier each night. Pick just one to start with. Write it down or fix it firmly in your mind. Next, consider a family or household action. What is one change we can make together? Examples include having no soft drinks in the house except on special occasions, or enjoying a family walk on weekends. Everyone could check their blood pressure at least once this year, or you could cook with less oil and less salt. Again, Pick just one to begin. These changes may look small, but over months and years, they can have significant impacts. These small habits can help reduce blood pressure and prevent weight gain. They can also delay or prevent diabetes and reduce the chance of stroke and heart disease. Our goal is not to be perfect. Our goal is simply better choices more often over a long time. We'll now wrap up and take your questions. Quick recap. Today we talked about what lifestyle diseases are: hypertension, diabetes, stroke, heart disease, obesity. Why they are a big problem for families and communities. The main risk factors: unhealthy diet, physical inactivity, tobacco, alcohol, stress, poor sleep, and family history. The importance of healthy eating, regular physical activity, not smoking, and moderate or no alcohol. The need to know your numbers: blood pressure, blood sugar, cholesterol, weight. Small daily choices and habits that can prevent or delay these diseases. Questions. I'd like to hear from you now. What questions do you have? Is there any part you want me to explain more clearly? Closing. As we close, remember, lifestyle diseases develop slowly, but so does protection. Every small step in the right direction counts. You don't have to change everything at once. Start with one habit. Protecting your health is not selfish. It is a service to your family, your community, and your future. Thank you very much for your time and attention today. I wish you long life, good health, and the strength to make healthy choices, one day at a time.